Hey guys, welcome back to season 2, episode 4 of Baker Health Talks. I'm your co-host Mo. Today we had the pleasure of interviewing pediatric dentist Dr. Sarah Salama. And today's episode, we're going to talk about how you can build $1 million smile for your kids at a young age. Enjoy the episode.
This is a guest and a topic we wanted to have for a while. I'm surprised we've been doing this. It's probably
And yeah, we haven't covered this.
Yeah, I should be ashamed. We've been doing this for over a year now. And one of the most important parts of your health, which is oral health, is something we haven't covered. And I think it's been in our mind, but we wanted to get the right guest. And we have some colleagues, and the colleague tonight is from a practice that we work very closely with. And she's got great background. We're going to talk a little about the personal journey, as we always do, and then get into some of the important medical questions people have about oral health. I think there's a lot of misconceptions. Even as a doctor, I continue to learn about the importance of oral health, like relations to cardiovascular disease, early death, stuff. Even in the medical community, I think we're pretty naive and ignorant about it. And so I'm looking forward to the conversation. I think a lot of the viewers and listeners will too. But before we do that, we like to just get a little personal background. So if you wouldn't mind just starting from the beginning, origin story style, like where your story started, and taking us up to how you got to where you are, and then we'll get into the professional side of things.
Okay, great. Thanks for having me here today. Such a pleasure to be with you all. My name is Dr. Sarah Salama. I am born and raised in Brooklyn, New York. I'm a New Yorker.
What part of Brooklyn?
Dyker Heights,
Okay.
Bay Ridge area,
Right.
Yep. I went to Wagner College in Staten Island, and then I went to Stony Brook School of Dental Medicine out in Long Island. And then I went to Brookdale, One Brooklyn Health for pediatric dental residency.
Wow, that's so you're a pediatric dentist, but you can do adults because you had to cover that first, right?
So yes, in dental school, absolutely. We definitely see some adults. I chose to be
Right.
a pediatric specialist.
Right. So now you spend your career seeing just kids.
Just kids.
Yeah.
Mhm.
Okay. Great.
I see infants, children, adolescents up until the age of 18.
How long you been practicing?
I've been practicing for about 4 years now.
Okay. How do you like it?
I love it. I can't imagine doing anything else. I say that's the best. I have the best job because I can take care of someone's smile.
I want to ask you some like borderline inappropriate questions.
Sure.
So, like,
You know she did Izzy's first dental
No, you
checkup?
didn't.
I did. Yeah.
I need to know how that went.
She had
she
perfect
cried.
teeth. No, she cried a little bit, but she had perfect teeth. You're doing
She's
a
my
great
favorite
job.
person in the world.
Oh,
I
she's
sat,
so
I
cute.
held her down.
Yeah.
You did?
Yeah.
And then we gave her a lot of stuffed animals.
Yeah.
We spoiled her
She
at the
put the
end.
fluoride varnish on, and
Yeah.
then she's like, nothing to eat for 20 minutes, then proceeds to give her a sugar-free candy lollipop.
Yeah.
Like-
Izzy's not going 20 without eating.
Yeah.
So, yeah. That's awesome.
We gave her like a monkey and
Yeah, yeah.
some pandas.
Last night
and-
I watched Teenage Mutant Ninja Turtles with her.
Oh,
movie.
cool.
I
Did
was
she like
crashing
it?
at my brother's place. Yeah.
She's
and-
adorable.
Yeah, she's awesome. So I'm gonna ask you questions. So don't take this the wrong way. But like I'll be sitting with kids as a pediatrician. I'm like, what do you want to be when you grow up? And some of them are like firefighter. And I can, even if I never wanted to be a firefighter, I'm like, there's like running into the fire. There's the hero element. There's like the cool, loud truck. I get it. Then I'm like asking them like, what do you want to be? And one of them will be like, oh, I want to be a basketball player. Obviously I get that, right? Like playing sports all day, like that kind of thing. As a kid, and even many adults, you dread going to the dentist. Like, no, like very few people, I've met a couple, but very few 8-year-olds are like, oh yes, I get to go to the dentist. And so I want to know what and when did you make that career decision? I'm always curious about it with dentists.
It's a great question. It is a big misconception. I was always around the healthcare environment. My dad was a pulmonary critical care doctor. I saw how he gave his patients the utmost care, the utmost passion, the utmost love throughout the years. And I knew I definitely wanted to do something in the medical profession, just wasn't sure what. And I felt like dentistry was the calling for me because I loved how I was able to provide immediate care. You know, if a patient comes in and says, I have a toothache or I have really bad sensitivity on this tooth, I'm able to provide care right then and there.
Right.
I love that aspect of medicine. So, and providing care to someone's smile, someone that's recognizable that everyone sees.
Yeah.
That's one of the first things that I personally see
Yeah.
because I'm a dentist. But someone's smile really tells you about their character.
And in the years you have been practicing, where has being a pediatric dentist reached your expectations, like, or exceeded it? And what are the aspects, if any, that have fallen short that you don't like?
I find it very rewarding. The reason why I went into pediatrics is because I always like gravitated towards kids.
Yeah.
Their
Me too.
infectious laugh, their smile,
Yeah.
their joy. I did a lot of missionary work, community service, and I always felt like I was always playing with the kids.
Okay.
I wanted to treat them with stickers, rewards, tell them they're doing an awesome job. And I felt like I was able to provide the service for kids, and I really loved hanging out with kids. And I find it's the best job for me. I think it's the best job, the best career.
Yeah. So, and how about like we were just talking about my niece Izzy coming in there and like having to be held down or whatever.
Yeah.
Because as a pediatrician for me, sometimes it's challenging to do an ear exam or a heart exam, but in the end, those are a few seconds. Like I just need the kid to be stable for a moment. You need the kid to be stable for much longer to do an oral exam. So when you have like a 2-year-old who needs to be there for whatever, 15, 20 minutes with the mouth, what are some of the ways you could palliate that kid? And I ask it even for parents who are listening, they could use those techniques just in general.
Yeah. So at our dental office, at Dental Arts of Paramus, we actually make it like a very friendly environment for the kids.
Yeah, your office is beautiful.
It has so many different colors.
Yeah.
It has Pac-Man. And we made it into like an arcade. So it's an environment that the kids are familiar with. And if we introduce it in that way, so first they come in, they play with the playground that we
So you
have.
desensitize them a little bit.
Exactly. We desensitize them. We show them. I personally play with the kids. The front
That's
desk
awesome.
does. Yeah.
That's great.
So we desensitize them. We try to make them comfortable first. And then after that, I'll show them on the big dyno that we have with the big teeth, how to brush their teeth properly. I always the first thing I put in their mouth is a toothbrush because that's what they're familiar with. And then after that, we do the oral exam and then teach them how to brush their teeth. Everything that is comfortable for them and for the parent.
That's great. That's a good system to use, like the desensitization modality. And I just want to confirm a bunch of things because I'm always shocked at what you're going to consider very basic, how it's lost on the community and doctors themselves. Because I get a lot of patients from like, hey, it's a 3-year-old that just moved in from Manhattan or from Florida to New Jersey, hasn't seen the dentist. And they're like shocked, like that I'm telling them they should have seen it. So first visit at about a year.
Yes. At about a years old is what the AAPD recommends, or 6 months from within their first teeth of eruption,
Right.
which is the lower incisor tooth.
And
Those are
then
their
every
perfect teeth.
6 months?
And then every 6 months, they should see the dentist. The more that you bring them in, we establish the early oral habits with them. They can carry that out throughout their lives. So the more comfortable they'll be as well with the dentist.
When should a child start using fluoride toothpaste?
So fluoridated toothpaste within a smear amount, it's only 0.1 grams. That's completely safe at, before the age of 3. And then at 3 years old, then you use like a pea-sized or a rice-sized
So
amount
I
of
tell
fluoridated
I tell my
toothpaste.
members, at 1 you go to the dentist and start using fluoride,
Mhm.
right? A little bit on the
Yep.
toothbrush, like that's that.
Just a smear. Yep,
Okay.
just a touch.
When do you expect folks to start flossing?
Flossing, great question. So if they have spacing within their teeth,
Okay.
flossing is not really necessary.
Okay.
If they have good, adequate spacing, and
Okay.
the dentist will tell you, oh, there's really good spacing between their teeth. Not really necessary to floss.
Okay.
But if their teeth are really tight touching each other, then of course, flossing is recommended.
Okay.
So it's patient dependent. It's individualized care.
Why does every adolescent I take care of have braces? When I was a kid, it was like 10%. Now it's
Yeah.
literally 90 something.
There's so many different reasons. Every patient is different. So it really depends if they have malocclusion, they have a crossbite, they had a thumb sucking habit growing up. It's so many. Every patient is different. So it really depends.
What's your best advice for the toddler who sucks their thumb and won't stop?
Some remedies are putting a Band-Aid over their thumb. putting a piece of tape, a glove, a mitten.
But they got to stop.
They should. They should, yes. They
Okay.
do. Because if they don't, then malocclusion happens. Their palate becomes really V-shaped, and a crossbite can happen, and their jaw structure changes.
Okay.
Yeah.
And do you deal with any dental trauma? A lot of the kids, we get a lot of members who will text us like through the app, like, hey, like
Bring them down.
we see-
We're
but-
always open.
but we see that we get like a message. It's like, I mean, this happens once a day. What I'm about to tell you.
Oh,
Ask
wow.
Mo.
Really?
It's a picture of like a kid's gaping mouth
Yeah.
with like the dad or mom writing underneath it, hey, Baker Health Team, this just happened. Samantha fell at the playground, and you'll see like a tooth is half cracked,
Mm-hmm.
blood, whatever. You deal with the trauma too.
Yep.
Can you give
absolutely.
some practical tips if a family's at home and their kid like chips their tooth at the playground?
Mm-hmm.
Can you speak a little bit about what they need to do and what not to do?
So let's backtrack a little bit. If they are in any sports, they should be wearing a mouth guard. So you can definitely get a mouth guard at the
Any
dentist.
sport.
Any sport.
Okay.
It's recommended. And within the fractures of dental teeth, it depends what kind of fracture it is, but they should always be seeing a dentist so we can take the proper x-ray, see what kind of level of the fracture it is, and what they should always do if they have any loss of consciousness or they're questionable about their mental status, always bring them to the ED first and foremost, but they should always see the dentist as well for their teeth fractures.
Okay.
Yeah.
And how often are you having to do some real work, like an extraction or something, with temporary teeth?
What do you mean?
Like, so the first set of teeth are temporary. They're
Oh,
right?
baby teeth?
Yeah. Right?
Yes.
Until about 6, 7, 8, right?
Yeah.
Am I right? Like,
About 6
yeah,
years old, yes.
6 years old, yeah.
Yeah.
So the way I was trained, and it might be wrong, is like when there's a little bit of an issue with the early teeth, it's a big deal. But it's slightly less of a big deal than with the permanent teeth, where it's a final, like that's it. So, for instance, we'll get mild discoloration on the baby teeth, right? Or let's say there's a crack or something. Or is it like you treat them the same, or is there some indexing or grading on a curve for the temporary teeth?
It's actually a great question. You treat them the same.
Okay.
I like to say that baby teeth are the precursors of the adult teeth. If you don't, it's like a seed in the ground. If you don't plant that seed, if you don't water it, if you don't have sunlight on that seed, it's not going to grow. It's not going to blossom. Those are baby teeth. If they are the precursors, they're the space maintainers for the adult teeth. If the the baby teeth fail, and you're just taking them out, then there's not going to be any room for the adult teeth.
Do you extract baby teeth for certain?
If needed, yes. If the infection is
So yeah, that can
fast.
happen.
Yep, absolutely.
Okay.
So let's just try to avoid that. Let's not extract any teeth.
Okay, pacifier is
So-
good or bad?
Pacifier is okay until we try to tell the parent to wean them off about 1 year old.
How about bottle feeding?
Same thing. Try to wean them off as much as they can about 1 to 2 years old, because if it's past that, then they can have malocclusion and the open bite and the
Okay.
V-shaped palate that we talked about. Yeah.
I want to ask you a few questions about how oral health affects the rest of your health, because that's an area that's been like evolving in recent years. Can you talk a little bit about how, if you don't take care of your oral health, how it can affect other organ systems?
So we can, like, periodontal disease is associated with heart disease as well. Most kids don't usually have periodontal disease. It's usually for the adults. It's very important.
That's
There's-
gums, right? Your
Yeah.
gums.
Yep.
Okay.
You should definitely see a periodontist if that needs to be assessed.
But that's rooted in good dental care in general, correct?
Oh yeah, absolutely. If you're brushing, you have to. What's recommended is brushing at least 2 times a day, flossing at least 1 time a day. I usually like to floss at nighttime. So it can also affect your breathing. You know, if you
Right.
have a really big infection and it's like affecting your airway,
Yeah.
that's really treacherous.
Yeah.
And we don't want that to happen. So seeing the dentist every 6 months is super important.
Okay. Great. And what if a child needs, like, I do have this happen. I'll get like a 5-year-old who moved into the area, who I'm meeting for the first time, 5 years old.
Mm-hmm.
And Mo can tell you. And then what happens is I'm like, okay, so he's been to the dentist, right? And then the parent, it goes quiet in the room. Kid hasn't been to the dentist. He's 5 years old or whatever, he or she. And I know that there's a good chance that I send them to the dentist. They find some crazy stuff. and now they need to actually put the kid under because they're gonna have to do real work. And so, do you do those procedures where the kid has to be under anesthesia? And can you talk about what are the cases where where a child may have to be under anesthesia?
Yeah, sedation. So we do sedation at the office, and in that aspect, it's either behavioral, they're unable to sit in the chair, or they have a vast amount of caries throughout their dentition, and they really need treatment on every single tooth or multiple surfaces. So we do sedation at the office where it's comfortable for the patient and also the parent as well. We educate them about everything from A to Z so that this doesn't happen again. We try not to do sedation. We don't want to.
What kind of
IV sedation.
Okay, you do that in the office.
Yep.
All right, and then you have like a nurse monitoring it or whatever.
An anesthesiologist.
Oh, so you bring that. So you have like a certain day that you do that,
Yes.
right?
Yes.
You book those cases on day whatever.
Yes. And it's a lot of times it's with special need patients
Sure.
that are really unable to sit in the chair.
But you don't go to like a surgery center. You just do it in the office.
Yes. We do it in the office.
That's pretty cool.
Yeah, it's great. It's one-shot deal. We could do all of it at one time.
Yeah.
The parent doesn't have to go drive in multiple services, multiple areas. We can just do it at the office.
Great.
Yeah.
This is like incredibly informative. The last question I have, and then if we have a few from the viewers and listeners, if you have one piece of advice to give, like whether it's dispelling a misconception or some tip that you're like, gosh, I just wish more people understood this about pediatric oral health, what would it be?
Make it a fun environment for the kids. Have fun with them. Play a song while you're brushing your teeth.
Oh, that's good. You mean
Yeah.
at home?
At home, yeah. Like, make it fun in the bathroom. Like, take your turn brushing your teeth and then brush their teeth. It goes such a long way if you just take your time with the kids and really listen to them and have fun with them. Make it enjoyable for them. And you can implement those oral habits at such a young age that they can carry out throughout their entire lifetime.
That's great advice.
Yeah.
Mo, do we have a couple of questions?
Yeah, I got a lot of questions. First question, someone asked, is there any specific food that my kids should stay away from that are bad for their teeth?
You know the answer. If you are going to eat some candy, what's recommended is brushing your teeth after, or limiting it amount you can have 1, 2, 3 candy throughout the entire week, and just try to limit it as much as you can.
Interesting.
Yeah, so sugar.
Sugar.
Yeah.
Next question, someone asked, best brand of toothpaste, and does it matter? And what's typically the best flavor for kids?
Yeah, you watch these stupid commercials. You would think every toothpaste was recommended by 4 out of 5 dentists. I'm like, statistically, somebody's lying here, right? The competitors are all telling me 4 out of 5 dentists recommend them. Mathematically, that's false.
Yeah, there's so much on the market. I love when parents come back to me and they tell me, oh my God, my kid really loves this toothpaste. So it really depends on the kid. Their palate is a wide range of flavors. So Hello is a good toothpaste. Tom's is good as well. A lot of parents love Crest or Colgate. So I say make it into a game for the kids. See which flavor they like the most and just stick with it.
It's almost like baby formula, like it's a marketing thing.
Yeah.
Next question. Someone asked, how do sealants protect against cavities?
So we recommend sealants at 6 years old when their first molars come in, which are all the way in the back. And your teeth have pits and grooves and fissures in them. So sealants are like a protective layer that we put over the back teeth to prevent any cavities from forming in those pits and grooves and get stuck in those areas. So if we put that soft layer on top of it, it can really go a long way.
My daughter, she's 14. She drinks coffee. Can you emphasize how bad it is and how it stains her teeth and that she should stop drinking it?
I'm a coffee drinker too.
Use a straw?
Use a straw if you're drinking coffee. I do use a straw when I'm drinking coffee. I do carry a Listerine or mouth rinse, and I just rinse my mouth really quick after I finish drinking coffee.
Gotcha.
To change the pH levels.
Wait, I drink a lot of coffee.
I do too.
A lot.
I mean, I drink a lot.
Yeah.
So,
like maybe a gallon a day, this guy.
It does stain your teeth, so just drink it.
I don't use a straw really.
That's
Should I use a
recommended.
straw?
Yep.
So,
But you have really white teeth.
yeah, but I think just eventually it's going to become I pound coffee.
Yeah.
Yeah.
So I should just, the cup I drink like that thing from Starbucks.
I'm just going to get you like a gallon of Listerine.
So just put a straw?
Yep.
and just drink it through the straw.
That's recommended. Yep. And then have that.
For me, it's easy because I like it cold.
Yeah.
Yeah. So you already have a straw.
Like you can't drink hot coffee with milk and sugar with a straw, like regular coffee.
Mhm.
You do that?
No, I drink it cold as well.
It's got to
I
be
did-
cold.
Yeah.
You see, but the thing is with Z, he'll like have 15 cups of coffee in the fridge, and we just toss the straws when the bag comes in. So I'm gonna hit BJ's tomorrow and get a
I
100
always
pack of
say
straws.
if I'm treating you and I haven't had a cup of coffee that day,
It's
it should be
malpractice.
malpractice. That's how off my game I'm going to be.
Yeah. I need 2 cups of coffee every day, and yes, I do drink it with a straw.
Next question. Someone asked, at what age should I start to worry about wisdom teeth for my kid?
So wisdom teeth aren't visible until they're about 17 years of age. So at 17 years, then after that, they could have discomfort all the way in the back. Those are your third molars. You're going to have your first molars at 6 years old, your second molar is at 12 years old, and then after that,
The wisdom
the
teeth in the
third
back.
molar is at 17.
Someone asked, what are your thoughts on veneers?
As a pediatric dentist, I don't do many veneers, but they're great. They're patient dependent. If they are needed, then yeah, we do veneers.
Now the real
The
question.
Hollywood smile.
In the States or in Colombia?
No, in the States. Here, come to our office. We'll make beautiful
You
veneers.
guys
for
do them?
Yeah, of course. Yeah, the general dentist.
Right. You don't
Dr.
not doing
Mike.
them on a 9-year-old. Yeah.
Yeah, I don't.
Next question. Someone asked, my daughter used her pacifier until she was about 5. Do you think she will need braces when she's older?
So a pacifier should be weaned off pretty within 2 years of age. And with a pacifier, you can have a constricted palate. And with that being said, that can make into a crossbite and malocclusion and an open bite. So every patient is different. And that, with that being said, like we have to look at the patient to really determine if they need braces or not.
Awesome.
Most likely, yes, but you know,
Depending on.
it's depending on once we see them and we really educate the parent and the patient about why the pacifier needs to be weaned off.
It's great. We covered a lot of important topics, stuff that every day I hear 100 times. Like I said, I think the importance of oral health and then the importance of getting it right early, foundationally, is something that's often overlooked. And I think tonight you did a great job of explaining where in a very practical way too, not in like an overdone, complicated. Nothing you said was overwhelming. I can't thank you enough. Clearly, you love what you do and you're really good at it. So
Thank you.
I know the viewers, the Baker Health members, listeners are going to be healthier as a result of this conversation. So thank you very much.
Thank
I have
you.
a question.
Of course,
What is your thoughts on whitening toothpaste?
If you find the right whitening toothpaste, then you have to find the right treatment for the right patient. There's various levels and percentages of the whitening toothpaste, so it depends on what your goal is.
Gotcha. All right, cool.
Beautiful.
Yeah.
Thank
Thanks
you.
again.
Of course.
Much
of
appreciated.
course. Thank you so much for having me.
Of course.